Binge eating, emotional eating. I'm a nighttime eater, and I'm gonna find out if I'm a binge eater or an emotional eater, or am I just always hungry? So let's find out more. Test our knowledge. What do you know about binge eating and emotional eating? Can everybody hear me?
Yeah, we can hear you. Take it
Yeah.
away, team. Do you see my slide? It might just be
Yeah, no,
a
I can see you. So
Good?
everybody's
Okay.
just quiet. Great, let's hear more.
Yes, I
All
can see
right.
it.
Yeah.
Yes.
All right. Yeah. We will first test our knowledge and see how much we know about binge eating disorder and emotional eating. So, question one, true or false? Binge eating disorder is more common in men than women.
I think it's more common in ladies. What do you think?
I also think it is more common in women than men. I think it's like yeah. Yeah, question two. So, which of the following is not a risk factor for binge eating disorders? We got dieting, TV shows, family history, and mental health conditions.
Okay, let's go through this over here. First of all, if you do have some mental health conditions, you're most likely to have an eating disorder. If it's in your family, it's probably in your genes. And people that are dieting are more likely to have a problem. I don't know how TV shows are related to binge eating. Um,
Yeah, I mean, it could help, but they're not a risk factor for binge eating disorder. Everything else seems right. Like your diet could possibly lead to binge eating disorder.
Jenny, very quickly, I know of a show that I don't remember the name of with suicidal ideation, but I'm not quite sure about binge eating specifically. So there's that the psychosocial phenomena of one thing that goes on and exacerbates a chain reaction in a community. I'm not quite sure the science behind it, but yeah, I think that's the most similar thing to it, but not a risk factor, as you said.
Yeah, yeah,
well, actually,
basically.
watching too much TV is a risk factor for dying because you should be out there taking care of yourself, not watching TV.
That's
Yeah.
true.
And you know what though? I feel like maybe TV could be like a trigger for like emotional eating, which we'll talk about later too, because
Yeah.
I don't know if anyone has ever watched people just straight like filming themselves eating like an insane amount of food. And sometimes like I don't like to watch those, but I come across those like a few years ago. Oh, I'm a little hungry too. Like I could go for some as well.
Yeah.
So maybe.
Yeah. So third question. This one, like you guys think.
You really need to be a lawyer here. I don't know the answer to that question.
Yeah, so the answer is true. So eating disorders, they're sorry, emotional eating is not an eating disorder. It's more so just a behavioral condition. It's a behavior, like eating behavior. And eating disorders in general are behavioral conditions that are characterized by severe and persistent disturbance in eating behaviors. So this is an eating disorder would be like if it happens like quite often, like I think for binge eating disorders, like at least once, like every 3 weeks. Whereas like emotional eating itself is just a behavior and it doesn't necessarily have to be happening as like frequently, as consistently. So effective physical, psychological, social function.
Yeah, and if sorry, Rad, would you be able to move back? So, it's also right, the Diagnostic and Statistical Manual of Mental Disorder. So there are certain criteria that has to be met for an individual to be diagnosed with an eating disorder. Yes.
Okay, we can move on to yep. So fourth question, true or false? Emotional eating only happens with negative emotions. I think we kind of like talked about something earlier that might be a giveaway for the answer. Yeah, so in this case, it is false. So emotional eating can also happen with like positive emotions or really yeah, just like example, like, you know, and you said something like when she's like watching mukbang videos, she's just like, it's like making her hungry and like, you know, makes her want to eat because the food looks yummy and all that. So emotional eating, although it does mostly happen with negative emotions, it's not always like negative emotions that cause it, but it's mostly negative emotions. Because food is like used as like a source of like comfort or cope for the negative emotion. Last question. What is the first line of treatment for binge eating disorder? Is it A, physical activity, B, willpower, C, medications, or D, cognitive behavioral therapy?
Well, to me, I'm thinking between physical activity and probably cognitive behavioral therapy because that's what people like to do. But I find physical activity a cure for so many diseases. So I guess the answer you're going to probably give us is D, but don't underpower the power of the Blue Jays in physical activity and being and belief systems and just going out there and being very physical. So I have to say
Yeah,
D, but
that's pretty, yeah, those two are pretty strong candidates.
Yes,
So
they're very close.
the answer in this case, yeah, would be cognitive behavioral therapy. And I guess like in a way, cognitive behavioral therapy could help like with physical activity. Like it could like help the person feel motivated to like do physical activity
I'm
to
not sure if it's my microphone. I'm having hearing Jenny. Can I
oh,
a little bit
sorry.
louder
It
there?
might be a bit muffled, sorry. Yeah, so cognitive behavioral therapy is the answer, although I think um it, like cognitive behavioral therapy itself could help like help motivate or like encourage the person with binge eating disorder to do physical activity, whereas physical activity itself, although it does help, like there's also I guess the it's more like they might
That-
stuff. So yeah, but again, those two are very strong candidates.
Yeah. And very quickly to add on to what Jenny was saying. So first line I think was the key here, key word here. So CBT is often used as first line treatment, especially if, and of course medications can be used afterwards if you know, an individual chooses that perhaps CBT is not just for them. And physical activity as well. We'll also discuss more about CBT, but physical activity is often used as an alternative or you know, an alternative activity to emotional eating, binge eating as well when discussing kind of treatment and management. So we'll discuss more about that.
Perfect. So yeah, now we will tie in and like briefly go over introduce ourselves to these two terms. So what is emotional eating? So as previously said, emotional eating is not a disorder, but it's rather like an eating behavior. And it's mostly emotional eating itself is used as a way to cope or soothe negative emotions. So if someone's like feeling stressed or like scared or angry or even bored, they might like eat because of those feelings, not because they are hungry of the emotions. And when it comes to emotional eating, sometimes it's not always also eating like so much. It's also like eating maybe stuff that are higher in calories to like soothe the those negative emotions. And a stress survey in the USA by the 30% of adults stated that they have engaged in emotional eating during the past month, and 49 of them actually engage in emotional eating on a weekly basis. Now, what is binge eating disorder? So here it is, binge eating disorder is a disorder that is defined in the DSM-5, and usually individuals with binge eating disorder tend to eat very fast until they feel uncomfortably full, and they eat a lot of food even though they're not physically hungry. Uh, and they tend to usually not feel good about themselves, or they tend to be very depressed or guilty after having that episode of eating a lot of food. And in international surveys, the lifetime prevalence of binge eating disorder is about 1.9%, so almost 2%. And as previously stated, it's more common in women than men, and it usually starts in late adolescence, like early adulthood. For binge eating disorder, about 79% of people who have a history of binge eating disorder also have at least one lifetime psychiatric comorbidity. So that could be like depression or anxiety. But nearly half of the people with a history of binge eating disorder have at least three comorbid conditions. And this disorder is also more likely to occur in people with a BMI of over 25, but could also happen to those with a BMI of under 25. Yeah, and now we'll move on to similarities and differences between these two. And in this case, we're going over similarities. So they do seem to be pretty similar. As previously stated, we've seen like both of them include disordered eating behaviors. And in terms of emotional eating and binge eating disorder, individuals tend to just eat more than what they usually would eat. And they don't eat, they eat like even though they're like not full or like not hungry. And it could also, and again, it is triggered as a response to stress or negative emotions mostly. And in terms of differences, there are a few factors that make emotional eating and binge eating disorder different. So first factor is trigger. So in terms of emotional eating is mostly triggered by negative emotions like stress or boredom. And binge eating disorder, the trigger could be like emotional distress again, so negative emotions, but also it could be due to like restrictive diet. So like, like they decide to like restrict a certain part of their diet, like cut out like maybe all sugar or something. And then as a result, they like start binging a whole bunch of sugar after that, or just they decide to cut out like a lot, like they decide to like just starve for like the whole day, and then like maybe like the next day or something, they'll just eat like a large amount until they're like physically uncomfortable. So those are the differences in the triggers. In terms of amounts of food, so between for emotional eating, binge eating disorder is a bit different. They are generally like a lot, but with binge eating disorder, it tends to be a much larger amount. Um, and this ties into the next factor is because of control. So emotional eating, even though the individual is eating a lot, they still have some sort of control. Like they're still able to kind of stop and like at some point realize like, oh, I think, maybe I'm eating like a bit more, too much. Like I think I should stop. Whereas the individual binge eating disorder, they tend to not be able to have any control. Like they tend to lose control with their eating during the episode. So that's why they would tend to eat until they like physically feel like full and like it's uncomfortable for them. So that's the other factor. And in terms of the aftermath, so how the individual feels after their eating episode, with emotional eating, individuals tend to just feel some sort of guilt. Like it's just like, oh, I like ate a bit more. Oh, okay. But the individual with binge eating disorder tends to feel like very shameful and very disgusted themselves, and they like just like regret it. And you know, since some of them again have like comorbidities with like the with psychiatric disorders, like it might worsen like their episode, they might feel even worse. In terms of frequency, the final factor, so again, like previously stated, emotional eating is something that happens like once in a while. It's not like that like consistent really, and it's just like once in a while, like triggered by like maybe strong emotions or something. But binge eating disorder, it tends to happen at least once like a week for 3 months. So that's like very consistent. And that's when it becomes like a concern. And yeah, if someone who is emotionally eating like notices that they've been doing it at least once a week for 3 months, then that's when like they should probably go get it checked out by the psychiatrist. and the impact on weight management. So how do both of these have an impact on weight management? So in terms of weight loss, so individuals with binge eating disorder, they tend to have like relapse rates about 30%. So in a study conducted in 1997, they had like participants like participate in some sort of treatment program to help them achieve abstinence, so like to like stop the binge eating episodes. And so in that study, out of 31 participants who achieved the abstinence after 12 weeks of treatment, 26% of those people relapsed within a year. So I think like with individuals with like emotional eating versus like binge eating disorder, the individuals of eating who just emotional eat, they have less chances of like relapsing compared to like those with binge eating disorder. And again, as previously said, with binge eating disorder, individuals might also have depression on top of that. So the depression aspect could also cause increased appetite and poor metabolic profile, leading to weight gain. So depression could also depression could make someone eat more, but also possibly like slow down someone's metabolism because they are not like doing much activity in general too. So as a result, their metabolism is going to be a bit slower, and that's also going to contribute to weight gain. And individuals with depression also take antidepressants, and sometimes like medications like antidepressants could have an effect on like their like their body metabolism, and also affect their eating habits and weight. And in terms of the final factor, social isolation is also something that could cause weight gain. So individuals with like binge eating disorder, they tend to like eat alone, and they also do feel like shameful about this, like and like disgusted. So they might like they tend to be like more like socially isolated and not like around others, so they're not really able to have access to like social support during these tough times. So the social isolation aspect of this could also lead to weight gain. Part of it is avoiding healthcare appointments, because part of it, again, like if they feel shameful and they don't feel good about themselves, then they're going to maybe not want to go to the doctor. And because of that, they're not going to be able to check in on their weight. They're not going to be able to check in on like aspects of their health and like, talk to a doctor to see how they can like treat this or like work on it. And social isolation, again, negative emotions and all that, they could result it could result to them consuming more energy dense foods and drinks, so stuff higher in calories, fattier foods, sweeter foods. And again, social isolation, so less engagement in the community, overall less physical activity. So they're not really doing much. They're just either like sitting or just laying in bed. So again, they're going to like slow down their metabolism from lack of physical activity, and like it will just contribute to weight gain. Yeah. Now we will be moving on to the psychological and biological mechanisms of emotional eating and binge eating disorder.
Okay, in terms of um, emotional regulation and dysregulation, in regards to emotional eating, a review by Cambridge showed that individuals who had clinical or subclinical thresholds of depression or anxiety were more prone to emotional eating. Among bariatric candidates, women reported having having or being linked more with emotional eating in comparison to men. And the reason for this was in relation to body image concerns, hormonal shifts as a result of things like menstruation, as well as poor emotional regulation. There are a lot of ineffective coping strategies and maladaptive cognitive patterns, such as rumination and negative self talk, that helps to or kind of reinforces the cycle of eating, and also makes it difficult for those who are having or experiencing emotional eating to manage their emotions rather than their hunger. All right. And in terms of binge eating, there's a cycle that it's called the restrict binge shame cycle. And this is a repeating cycle where a person who is experiencing binge eating will have restrictions, binge, and then feel shame um, upon eating. And it starts with oftentimes with people who are doing things like strict dieting or food avoidance, and that leads to deprivation from eating. When emotional or physical triggers arise, they tend to lose their self control, and this also results in binge eating. Afterwards, the individual may feel intense guilt and shame set in and reinforcing those restrictive and then reinforcing those restrictive like behavioral patterns of eating or staying away from eating for a while, and then that cycle continues again and again. Breaking this loop of restrict binge shame is something that requires a lot of self-compassion from that individual, balanced nutrition, as well as addressing those underlying emotional and cognitive factors that are causing them to feel guilt and shame, as well as breaking their cycle. A little bit more about um, some of the other um, things that are mechanisms that aren't that are seen in studies but not generalized a lot. We did talk. I did does talk a little bit about women, in particular bariatric candidates, and how this is in relation to emotional eating driven by things like body dissatisfaction. Another case is in children as young as 9 years old. There have been studies that have shown that binge eating behaviors already display differences in their brain functions related to things like reward sensitivity, emotional regulation, as well as inhibitory control. These are early patterns that highlight the importance of early intervention and prevention strategies for especially those that are young and having trouble controlling their ability to restrict or manage their food consumption. And emotional eating is another strong predictor for future weight gain. Um, in the same study by Cambridge Review, individuals who use food to cope with distress are more likely to experience long-term increase in body weight change. And like I said before, depression and anxiety further intensify this behavior, creating a feedback loop where emotional vulnerability and obesity tie in together and create that dysregulation in person's self-esteem as well as in their body weight. Targeting both mood regulation and psychological resilience is a huge key in helping to improve eating outcomes as well as managing your weight better. In terms of biological mechanisms, I won't go too much in detail into the uh, pathways and genetic factors that go into um, brain reward circuitry. A lot of things such as dopamine and serotonin pathways, hormones like leptin and ghrelin, and genetic and epigenetic factors play a role in the craving and reward response that people tend to feel when they're binge eating. These are biological mechanisms that interact with a lot of psychological stressors that make binge eating both something that's reinforced both emotionally and also biologically. And that's why a lot of treatments integrate sometimes both a psychological approach as well as a medical approach as well. All right, and then in terms of cue responses, um, another study done by brain scientists showed that brain imaging studies that individuals with binge eating disorder display heightened activation in the medial orbitofrontal cortex. This is the brain's reward center when viewing high calorie food images. Compared to overweight or those with normal weight controls, those be binge eating disorder participants experienced stronger cue-induced cravings. This altered their reward processing means by like visual exposure, as well as trigger intense urges when seeing high calorie there's a neurological basis to binge behavior and the importance of cue management in treatment as well.
That was actually a very interesting study, Trisha, and we'll definitely talk more about cue management later on when we talk about CBT too. And so, as mentioned, as Trisha and Jenny have mentioned, binge eating disorder and emotional eating are risk factors for a lot of physical and mental conditions down the line. And so, if emotional eating is the only coping strategy an individual has, it can lead to binge eating disorder and a higher risk of other eating disorders. And that's why early recognition of symptoms and warning signs are really important for prevention and management. And so when we talk about emotional eating, being able to know the signs here is the first step is identifying your triggers. Are you reaching for something sweet or salty, a bad day? Do you eat in response to certain people or situations, places, or maybe times of days? And so it's being able to kind of sit down and reflect on those. Now, pause and reflect. Second step is pause and reflect. Are you and grab and reach for whichever treat or whichever type of food that you tend to gravitate towards? Try to pause and ask yourself, are you really, really hungry right now? Is your body physically hungry? Or is it because of something that you've thought about? Is it something that someone made you feel or a situation made you feel? And the third step is develop new coping skills. So talk to someone, walking, stress management, give yourself something else to think about during these times, pick up a hobby. And using these strategies, you may give time for your emotions to de-intensify. And perhaps with the reduction in that like kind of emotion, it could just lead to you not wanting to eat anymore. And we'll talk more about strategies to develop coping skills, how to pause and reflect and stuff like that, so on and so forth. And when it comes to managing emotional eating, it's always good to plan ahead. So if you know that a stressful time is going to be coming up for you, for example, exams, perhaps a really important time at work, perhaps you have a family event so that's very stressful. You have to plan. You won't be able to eat very well for a long time, for a bit of time. Then plan for it. Be able to kind of try to pick certain foods, put them into your fridge, and meal plan or something. And I know that our cooking club definitely has some great resources, and I know just online in general, a plethora of resources out there. The next is substitute foods. Being able to find healthier or maybe less calorie-dense substitutes for your favorite meals. For example, I know Dr. Curnew really could be a little better. And the third one is mindful eating. So I know we discussed mindful eating a lot in the past. It's not just eating slow, but being intentional about the food you eat. And so yeah, and I feel like it's a common misconception, but we'll talk more about it. So ultimately, we want to build a healthier relationship with food here. Researchers use mindful eating to help reduce emotional eating in patients with overweight and obesity in primary care. So next, please. Yes. So in this randomized controlled trial, so they had 76 participants with overweight and obesity who were assigned to mindful eating for 7 weeks and treatment as usual, or TAU in this case, alone. And so I think a very important point here is that weight loss was actually not a primary goal of the intervention. And they wanted to be able to measure kind of the emotional eating behavior. And so they measured at baseline, post-treatment, and 12 months later to see how well these two groups did. And so we see that here, the treatment as usual group, next please. Thank you. So just a little bit more about the intervention. So the treatment as usual group is the treatment that their general practitioners, their family doctors administer to patients with overweight or obesity in aims of reducing BMI to a normal range, which is under 25 in this case. And they tailor it to the patient, and they have 2 interviews. At the beginning of the intervention, they have 2 interviews with their general practitioner and a nurse to develop a nutritional plan and some talks on health and nutrition. So they have 7 sessions, about 1 per week. But the mindful eating program, they also have the mindful eating program intervention on top of the treatment as usual. So they get all of that treatment as usual, their interviews, that nutritional plan. They also get a 7-week intervention delivered 1 time a week in 2-hour group sessions conducted by a clinical psychologist. And the goal of mindful eating was to develop awareness and consciousness of hunger and learning about emotion and hunger patterns for themselves personally. And what they found was that the mindful eating group and the treatment as usual group reduced emotional eating at post-treatment and follow-up 12 months later compared to treatment as usual alone, and also reduced external eating. And even though the physiological measurements like weight didn't really see any significant changes, I think in this case it's fine because again, the goal of the program was not weight loss. And when to seek help for suspected binge eating disorder. We also touched upon some of these earlier, but just a quick recap. You may feel depressed, disgust, or intense guilt after a session of overeating. You eat a large amount of food in a short amount of time to the point of discomfort, and you feel out of control during these episodes. You binge eat at least 1 time a week for 3 months, and you eat alone. You tend to eat alone because you're embarrassed about the amount of food you eat. And so if you're concerned, if you have any concerns about any of these, perhaps it's time to chat with a professional, your family doctor, to see what kind of help you could get. And so when it comes for treatment for binge eating disorder, psychotherapy, as we talked about in our quiz much earlier, is the first line of treatment. And this includes CBT, cognitive behavioral therapy, interpersonal psychotherapy, dialectical behavior therapy. And so interpersonal psychotherapy is a form of talk therapy that focuses on the link between a person's mood and their relationship with others. Dialectical behavioral therapy is a type of talk therapy, again, that helps people manage intense emotions and relationships by teaching skills such as mindfulness and emotion regulation to reduce self-destructive behavior. So quite similar. And for CBT, we'll discuss more about that later. Pharmacotherapy, so medications, when either psychotherapy is not available or a patient prefers medications. So the recommendations begin with serotonin reuptake inhibitors, or I'm going to mess this up, lisdexamfetamine, which is actually the only FDA-approved drug for moderate to severe BED in adults. This is a stimulant. And so, yeah, so it's SSRIs, or it's this lisdexamfetamine. And so the next option is also behavioral weight loss. This is often combined with psychotherapy for long-term maintenance effects. So it involves reducing caloric intake, increasing activity, and focusing on nutritional quality. And so this really involves a broader interdisciplinary team of nutritionists, psychologists, and social workers. And if recommended, patients may also be referred to weight loss clinics or bariatric surgery only if the patient has also developed significant physical comorbidities as a result of binge eating disorder. Yep. And so now, CBT. The purpose of cognitive behavioral therapy is to change the way we think, so the cognitive portion, and act, the behavior portion, in response to challenges in life or cope with hard times. Being able to recognize patterns of thought and behaviors that may be creating issues in your life, and finding different ways to approach problems, and again, learning how to cope. And this type of therapy really relies on the idea that our thoughts, feelings, and behavior, are really linked and registered psychotherapists. And as we talked about earlier, can also be used in conjunction with other type of therapy or treatments to help with emotional eating and binge eating disorder. And there's actually some techniques that you can actually try at home that are inspired by CBT, including identifying your triggers, as we talked about earlier as well. Keep a mood or food journal. This is also a time for reflection. After bouts of binge or emotional eating, think about what drove the behavior. Was it something someone said, thought you had, a certain situation? And again, learning to recognize triggers is important to initiating healthy responses instead. And next one is challenge your thoughts, alternative coping, and learning how to be comfortable with being uncomfortable. And so let's talk about that more in the next slide. So this website at the very top here is a free self-guided manual to use CBT for a BED. And we can also link that below. So this is based off this is from the NAADAC, the Association for Addiction Professionals. And we talked about earlier about identifying triggers in order to break the relationship it has with binge eating responses. And so some triggers mentioned can be categorized into social, like social isolation, situational, like you're passing by a bakery or a fast food restaurant, you smell it, you think of something, you think, oh my God, I could totally go for something there. Or it could be physiological and nutritional. You're hungry or tired, or it could be mental. It's memory or mental image that's kind of sparks and triggers you wanting to eat something. And what do you do when these things happen? Well, this one, yes. And so what do you do when these things happen? Well, avoidance is usually the first line, is try to restructure your environment if to avoid whatever is triggering your craving for food. For example, try to use a different route. If you drive past like the same McDonald's every day, and every time you drive past, you can't help yourself but want to get, or maybe like Tim Hortons, you can't help yourself but get a donut. Maybe try different driving routes. Try to like round manual linked above. And we'll also link it below. And so the next one is restricted stimulus field. So to reduce the frequency of binge eating, then restrict the trigger. So for example, only eat at the table away from the TV and eat in the same room every single time. So again, strengthening the cues for desired behavior, maximize the time and the situations where you exhibit healthy behaviors. For example, maybe you tend to binge eat at home when working. It's easy to grab a snack and kind of munch on it and chew on it, but try working in another space, like in the library where everything's really quiet. You won't be as tempted to pick up something like a bag of chips where it can be super loud. Yeah. And so ultimately trying to build upon these associations with healthy consequences. And so alternative behaviors. Want to replace maladaptive behaviors with adaptive behaviors. Or go on a walk. And you can do, it's best to create a list of things that you can do when situations like this happen. And the manual also provides a bunch of examples, but ultimately it has to come from you and your own interest and something that you know that you will like to do and enjoy to do. And it'll be a good enough distraction for you during that time. For example, if this was also listed there, if your camera is on in a meeting, then you won't be bored and you won't be snacking. So keeping your camera on can be a good way from keeping from distraction. Also, the next one here is build a pause between your trigger and binge eating. So again, this comes with dealing with discomfort. For the example used was, if you eat something sweet like a chocolate bar, you're having a bad day, something didn't go right, and you get a chocolate bar, you eat it. And you know that this is a cue and this is a trigger for you to ultimately eat a lot more sweets, a lot more stuff down the line. Set a timer on your phone immediately for 15 minutes before you can eat another. And so after this 15 minutes, in the future, you can slowly increase the amount of time that you have in between. So you do increase the pause in between the trigger and the binge eating. And so it'll be really uncomfortable at first, but as we discussed, the process of the beginning may be so as we are restructuring our brain. As Tresha mentioned, even for individuals with binge eating disorder, even their brain structure, like their brain reacts differently to food. And so it is really uncomfortable, but we're building that resilience, like we're changing our brain. And so we have to do our best to accept and ride out the discomfort and build that tolerance over time. And you may find something else during those 15 minutes that take up your focus, and you may not need that extra chocolate bar 15 minutes later. Yeah. Awesome. And the last one we'll talk about is challenging your maladaptive, and in other words, unhelpful thoughts. And so challenge your thoughts. Think of it like a courtroom. Gather evidence for and against it. So for example, the situation is you ate a few cookies in the afternoon, even though you weren't that hungry. The maladaptive thought is, oh my God, I've already failed today. I have no control around food, so I might as well keep eating, right? The whole day is ruined anyways. And so the evidence for this is, well, you ate more than planned. You've had this pattern in the past. Evidence against it is, well, one slip does not ruin an entire day. In the past, you've stopped overeating, and after a slip, and felt better for it. And so everyone sometimes eats when they're not hungry. And now the new response and the adaptive response, or in other words, the helpful response is having a few cookies doesn't mean I failed or lost self-control. I can choose to accept this, stop now, and continue with my planned meals. One choice doesn't define my whole day. And I know Dr. Curnew also loves to say, like, if you trip and fall, get right back up again, or fall off the horse, I believe. If you fall off the horse, get back up on again.
I think it's get back on the train.
Get back on the train.
Yes,
Oh my
yes.
God, I'm sorry. Yes. Well, yes. But yeah, so write it down, say it out loud to yourself, anything that'll help it stick. And so these are really tough, especially when changing your own thoughts, right? Because we've no matter how long it's been, like thoughts that we think to ourselves, we're our own worst critics. Write it down, say it out loud, anything that will help you. Just even if you don't believe it in the moment, just say it. And so, and as mentioned earlier, it's too easy to be mean to yourself. And when you think about it, why be mean to yourself? It's not very helpful most of the time. And you end up very unhappy anyways. And then it's kind of restarts this cycle of just being unhappy and being unhappy. Maybe it's a trigger for your emotional eating. And then it's just a terrible cycle. And those times I like to remind myself of these very inspirational quotes here of this very cute cat on the left. I've decided to be happy because it is good for my health. And this cute frog on the right here said, did I hear negative self-talk? Please do not do it. Right. Next, please.
It's just loading, Anya. Apologies.
Oh, my bad.
I do like the concept of, pausing and reflecting, and keep telling us more.
For sure. Yeah, and so to kind of put CBT into action, being able to apply to real people in a real life scenario, there was a study done in 2010. It's a blended efficacy effectiveness study. So this means they evaluated both strict clinical outcomes. So this is the efficacy part, and how well the intervention actually worked in real world healthcare practice. So the effectiveness part of the blended efficacy effectiveness study. And so what they did was they investigated 123 adults with binge eating disorder. So 48% had binge eating disorder, or they had bulimia nervosa, which was around 10%, or they had recurrent binge eating without a diagnosis of bulimia nervosa or binge eating disorder. And so they measured them at baseline, post-treatment, 6 months, and 12 months later using standardized interviews and questionnaires. And so these participants were randomly assigned to either 8 sessions of self-guided, a structured self-help program with professional guidance of CBT over 12 weeks, with the main goal being to develop a regular pattern of moderate eating, or they receive treatment as usual. And so a little bit more about the interventions in the next slide. So, yes. So sorry, as for the treatment as usual, they were part of a healthcare promotion organization. And so their treatment as usual was that they had access to a lot of different classes, like physical activity classes and different resources, but it was up to them really if they decided to go for it or not. And so at 12 months, 64% of those in the CBT group achieved abstinence from binge eating behaviors compared to 45% in the usual care group, but there was no significant weight change. And again, for these studies, weight loss isn't the primary goal that they're looking for. And so through various validated questionnaires, the CBT group also saw improved dietary restraint, reduced concerns about eating, body shape and weight, and decreased depression and social impairment scores compared to usual care. And so we can see that it's not just the behavior that's changing, but also a bit more about a change in mindset. So they're less worried about eating, their body shape, and their weight. And so we can see that CBT does not help just pure behavior, but also helps with the change in mindset. Next, please. So now CBT isn't always right for everyone. It's very helpful, but it really depends on what your goals are and what you need. And so as we mentioned before, there's a lot of different types of psychotherapy. Maybe CBT isn't the one that you need. And so CBT involves actively working on practical skills, being assigned homework by your therapist, and being able to address specific current problems that you may have. And so these are learning skills to cope. To find a therapist, we recommend using online directories. For example, the Ontario Psychological Association has a list of registered professionals who are able to administer CBT. And you can filter based on location and financial requirements. And many also have sliding scales to adjust to what you're able to pay in that moment. And also please check with your insurance to see what is covered for you. And you can also base your decision off of that. And you can also get referrals from your family doctor or personal network. The Ontario Structured Psychotherapy OSP program here is completely free. It's publicly funded, and it's short-term CBT with a psychotherapist. And this is through self-referral. So if you go online, we can also link this below. You can go online and find the link and fill out a quick form, and they'll try to connect you with someone in that area. And this is worth a try. And also, it's important to remember that many trial appointments, for example, you seek out a professional, a therapist, many trial appointments are very short intro calls, 20 minutes or so, and they're completely free as well. And so it's really like a no strings attached kind of way of saying, okay, well, do I get along with this person? Am I open to trying this? Am I open to trying CBT with this individual? So yeah, it's always worth a try. Next, please. And now kind of coming back to more medical, medications kind of treatment and management. In recent years, GLP-1, also known as glucagon-like peptide 1, has been seen as a potential for treating binge eating disorder. And so GLP-1, we know from things like Ozempic and semaglutide, which is known for its appetite suppressing effects. And it's currently used off-label. It is not approved to treat binge eating disorder. As we talked about earlier, the lisdexamfetamine, like that one, the stimulant is the only FDA approved drug currently for treating moderate to severe BED. And so in one open label study of 48 patients with a moderate to severe BED were split into 3 groups. So they were semaglutide only, had 19 people. And then one group had taken other anti-obesity medications, including lisdexamfetamine, which we talked about earlier, which has known abuse potential, and topiramate, which is used to treat epilepsy, is also commonly used off-label for binge eating, but also has many contradictions. So this is on the left. And then the third group was semaglutide plus any 2 of these anti-obesity medications. And so what they found is using the binge eating scale, so BES, which is a validated questionnaire to identify binge eating, the researchers found that the semaglutide only group experienced greater reductions in the BES scores compared to other groups. And so the semaglutide and the other anti-obesity medication group did not have a greater reduction in BES compared to semaglutide only. And so we can see the potential that it has here. And a recent systematic review thank you. And a recent systematic review that investigated animal and clinical studies also concluded that, overall GLP-1, like liraglutide and dulaglutide, show potential in reducing the binge behavior and comorbidities and improving psychiatric side effect profiles. For example, this may exacerbate psychiatric they might exacerbate psychiatric conditions as well. But currently, it's lacking large-scale blinded placebo-controlled trials to test the efficacy, safety, the optimal dosing, and the effectiveness among different GLP-1s. And so it's promising, and perhaps further down the line, it could be used as an effective treatment. But yes, more research is needed. Now, managing it's always best to join a support group and reach out to your support system during times like this. And so I know our clinic's weight management group, Trisha is one of the co-leads for that group. They meet every Tuesday, so it's also a great way to stay accountable. They meet every Tuesday evening to discuss some fun things. And it's also great, just a great little community to have as well. It's also important to schedule regular eating times. It really depends on your own schedule. I know it's tough sometimes, but really, really, really trying your best to eat at the same time every day can be very helpful. It can help you reduce your binge eating, or at least binge eating or emotional eating bouts. As you know that a scheduled eating time is coming up, you'll know when it's coming, and you'll know that you're going to be prepared to eat. The next is stimulus control by healthier alternatives, as we talked about, or by less of things you know you tend to eat in response to negative feelings and thoughts. I know for me personally, I love sweets. I love candy. I used to love these little like packs of like jelly that we got at the grocery store. But every time I sat down to study or like do any work, that entire pack of like 24 would be gone within like the time I was working. And so I've just learned to ask my mom to not buy it. I've not bought it. And so even though I really crave it, I wouldn't go out to buy it during those times. And so it's really helped me kind of cut down on that sugar in that aspect. Consistency is always key. And staying away from dieting. As we talked about in one of the earlier, as Trisha had mentioned in one of her in her section, dieting is also one of a risk factor for developing BD or emotional eating. And so I think it's important to remember that the ultimate goal here is building a better relationship with food and developing better strategies to cope with hard times. And here's some more resources for help if you would like to kind of review to check them out. These are all over here. Please screenshot it or look it up if you'd like. So two of these are based in Hamilton, St. Joseph's Healthcare and Body Brave. Yep. And then key takeaways here. It's not just a lack of discipline. And so there are real biological and environmental factors that drive emotional and binge eating that can impact your overall health and not just your weight on a scale. And it's important to remember that you're also not alone. There's a lot of support out there for you. Don't hesitate to seek out help from friends, family, and professionals during times like this. And again, beyond losing weight, we want to build a healthier relationship with food that will last a lifetime. Okay? That's about it from us. Thank you so much for listening. And we look to any questions you may have.
Wonderful. So, question for you. A lot of people are nighttime eaters. Some people use time restricted eating. So I get if you're a time restricted eater, you're going to eat more when you eat in your window period of time. And I guess studies have shown on average you can eat on average 500 less calories. So you time restrict and you don't have these large consumption of food. You have a higher consumption of food, but some of us have a bigger consumption of food, and some people just eat at nighttime more, and part of it could be habit, part of it could be something more. So how do you help people with nighttime eating? How do you classify them?
Interesting. Well, I mean, Brad, Jenny, Tresh, please jump in, whatever. I think when it comes to nighttime eating, I feel like if it's part of like your usual routine, like if, for example, you don't eat until a lot late, for example, like time restricted eating, if you don't eat till a lot later, you just end up eating at night, as you still need to fulfill your daily energy requirements for the day, because food is still good for like in terms of like you need to fuel your body. But if you recognize that you're eating a lot more late at night because of maybe certain other reasons, maybe you eat to as a way of de-stressing, maybe you eat as a way of just like it's part of the habit, and you're not actually very hungry, I think that's when it's time to like kind of recognize, okay, maybe there's something here. And as we talked about, maybe substituting certain things, maybe you start off at white bread, maybe you can switch to a different type of bread, and then maybe after bread it could be something else, maybe a smaller portion of something else, and then maybe moving on to all the way to like water or something, like to liquids. And so even though you're hungry, you could just like replace the chewing or something else in your mouth with something. I know a lot of people like to eat gum to kind of just mimic like the chewing. But I think it's always good to be able to first like reflect, as we mentioned, pause and reflect and say, you know, why am I eating? Is it because I'm actually truly very hungry? Did I I know Dr. Curnew, you walk around a lot. You're very active during the day. So maybe it could be that. Or am I just eating because of some other reason that's not related to my physical like energy needs? Yeah, that was very roundabout. But Rad,
Yeah,
Jenny,
Annie,
Trev?
you just got me the idea. Remember that picture I put in a few webinars? You open the fridge, there's a poster that says, "Just shut the damn fridge, you're bored." So boredom is
Oh,
definitely
yeah.
boredom is mine, right? I check the fridge multiple times a day. I come back with nothing. So my strategy is if there's no food, it won't be eaten. So I just try to not have food around or just have meals and not have snacks, sometimes nuts. But the other one is just being flexible, honestly, as you said. Like, you got to have your calories, and if you're going to eat, it's okay, just eat. Just focusing on healthy options, right? Yes, it's not ideal. We're less insulin sensitive at night, as Dr. Curnew always mentioned, but if it's part of the routine and it's good for the mental health, it's okay. But it's usually the choices. And for people who struggle with binge eating disorders, it's the amount, it's the number of calories, it's the macronutrients, it's the, that's the big problem. Like, if we go back to the basics, it's first of all how much you're eating, I think. Then it's what you're eating. Then it's when you're eating, in that order,
Like
probably. So.
the control.
Yeah, and
Like
control the
how much
controllables,
yeah.
be
Yeah.
flexible with be kind to yourself. Dr. Curnew, I'm talking with yourself as well, where, you eat at night, it's okay, focus on the good foods, and Greek yogurt with banana or blueberries, good snacks, or a little bit of nuts, or maybe a low-calorie drink, some tea, that kind of stuff. Good choice. I think any of what you said was good. Some nice
Yeah.
swaps, some replacements. What you eating is probably the most number one important thing at that stage.
And like Dr. Kearney, I know if you like something like savory, I know because I know I usually eat bread with something savory. I know you introduced me to those cognac noodles. So maybe that could be like an option too. Like they're very like I think you told me I think they were like zero. They're either zero or very low calorie, and you can add a few like toppings to yourself, and it's still a good little snack to keep your mouth occupied
Yeah.
at night when you're really craving that bread.
They're like low in carbs, I think. Like very low in carbs.
The cognac noodles, I can't
Yeah.
remember, but it was a label. I remember Dr.
Yeah,
Kearney
so
gave me
yeah, cognac noodles are just are basically derived from oh, I'm drawing a blank right now, but basically they're very low calories. They're
I think they're plants. I think they
plant-based,
got from
exactly.
plants.
Yeah. Instead, a big bowl of pasta is about 200-300 calories. These are 30 calories, but they have non-absorbable carbohydrates. So you have to be careful. You get bloated if you eat too much of it. So to me, you have to blend it with some others. So I think they're good, and they're helpful. So I blend those. That's great. Yeah.
Interesting. Annie, can you send me a sample from a grocery store for that? I want to put it on our booklet. Yeah, I didn't know about that. It's good.
Dr. Kearney, it was a few years ago. It was like 2 years.
Yeah.
Maybe
I'll
now.
say so. Basically, it's found in many Asian cuisines and things of that nature as well. So they're relatively expensive. They're low in calories, and I just blend them. They're not that easy to find in around Hamilton, but more in specialty places. Sometimes you can find them at regular supermarkets, but not too often.
Okay.
But I like this idea of pausing, reflecting, mindfulness, and I think we all start off with good intentions. Okay, I'll have that apple, make that substitution. I'll go for the cognac noodles, but we tend to break down with willpower or whatever is at some point in time. And it's interesting. I was having some dark chocolate, and so started to eat it, and I just I'll pause and reflect and not eat it for a while. So I put it away for a bit, and so instead of eating the whole bar, I ate 3/4 of the bar. So that's an improvement.
Yeah.
I had a crazy idea once, actually. So I had some ice cream. I think it was a few months back. I'm not quite sure how realistic this strategy is, but I took a very small spoon to eat the ice cream with. Like, it was smaller than a teaspoon, maybe teaspoon size. Where the idea of an ice cream is just to get that craving, the taste. You don't have to eat the whole bucket. So I noticed that you just naturally you eat less. So get a different spoon. Get a small spoon. Naturally, we just have more bites. And the other one is, like many of us, you mentioned the TV, Annie, in the beginning. We eat and multitask, watching, listening to something, doing one task at a time, it's probably the most mindful approach, as an example.
Yeah,
Just
for
focus
sure.
on what you're eating, focus on the taste, and do nothing else. Be present.
And you know what? That reminds me of a study actually. I can't remember what it's called, but it was like a soup study, I remember, is that they measured how much soup people drank when they were distracted versus when they're not distracted.
Yeah,
And they
yeah.
found out that people couldn't tell. Like they could have eaten like a lot, they could have drank a lot more soup, but still felt the same level of fullness when they were distracted versus when they're like, eating peacefully and just only eating. And so yeah, that reminds me of that.
All good strategies there. Actually, one of the things my son does sometimes, he makes these protein shakes with lots of berries in the morning, and he leaves some left over, and he actually puts it in the freezer. So to me, it's like it's a later snack, and I have a very small spoon as well, by the way, that I eat
Yeah.
it with.
I
And
I also
so I try
oh
different.
yeah
Go ahead.
oh yeah like I remember something I started doing too was like I used to like eat like what Brad said, eating like with smaller spoons, but also I at home like I tend to like my family we tend to like eat rice like on a daily basis, and what I started doing was I started using chopsticks to eat instead of eating with spoons. Like I used to have big spoons, and then I downsized to a small spoon, and then I started like using chopsticks instead, and I found that it helps me eat like relatively less portions, and also just in general like eating slower is usually good, especially since like it does take like the brain like 20 minutes to like process that like, oh, you're probably full. So if you're like eating fast like during those 20 minutes, like your brain is probably like, not able to process that you're full yet. So like you're able to like get
Yeah,
in
yeah, yeah.
a lot of stuff. Whereas if you're eating slow, then like once your brain processes, then that's when like you start actually feeling that fullness.
You remind me a little bit like the Toronto Blue Jays. When you're in last place, now you're in first place, and you have a bad game, and you think you're down and out, and then you rise from the depths of disaster and rise again. So if we all think like the Blue Jays, trying to get better, trying different ideas, team approach, we can do it, and it's a happy time. And don't be so hard on yourself. You know. I guess the difference between professionals and mere mortals is that they have their moments, but they keep trying and keep getting better, and um, they don't stay negative. And I think it's something a lot we can learn from. So I'm gonna have my good days and have my bad days, but I'm gonna take my swings. Um, I don't think I'm gonna get. I might get 5 cents, not $500 million, but and just enjoy the journey a little bit more. So I think you guys came up with a whole bunch of great ideas. What I'm going to take away is I'm going to try to reflect a little bit, take a pause, put things away, try to have healthier foods along the way. But some days I'll give into those cravings, some days I'm not, and I won't. I can strike out one day and hit a home run the next day. So I'll keep trying, and as long as you keep trying and not being so negative about things, good things will happen.
Of
Blue
course.
Jays 7.
Yep, of course. Thanks again, everyone. Any last thoughts from yourself, Dr. Curnew, team?
I think that was wonderful. I think you guys always teach me a lot. Surround yourself with people who are trying to get better, and enjoy the moments.
Good night, everyone. Good night.
Good night.
Everyone.